Good day, my people. It's your king, Aaron D. Wiggins, and it has been way too long, and I'm so excited to produce more content for my people. You know, I took this time to get a master's in public health from the Morehouse School of Medicine. And now, as a master of public health, I know even more about public health and what it really means to go for the people. Now, let's start it off from the top for those who are just coming in. Public health is the art and science of preventing diseases, prolonging life, and promoting human health through the organized efforts of nurses, doctors, dentists, epidemiologists, environmental specialists, and even many, many more. From my studies at Morehouse School of Medicine, I've become able to categorize public health, because they taught me the need for community-focused public health education, research, and practices. And to help you on your journey, I put public health into 5 categories so far. And at the end of the videos, I'll tell you why you should get an MPH degree. But please click on the link and do the follow thing so you can see more about my content about public health and their issues. And let's collab in the comment section for the first hour. But first, let's get to this video. Categories of public health. Now, quick disclaimer, any of these categories can come under a government organization or a public entity. When it comes to addressing public health, you have to realize that everyone can contribute to their part. And a major part is preventing or treating these diseases as they come up. The area that does this is clinical health. Clinical health really refers to, all the doctors, all professions, and the medical staff that support them. The nurses, the doctors, the dentists, and the mental health experts. These people are responsible for making sure that you go back to a point of health once you have an onset of disease. Another category of public health is research studies. I like to define research studies as the application of the scientific method and the ethically backed clinical trials or clinical studies to produce health services, health products, and best practices to the public. So this means that the epidemiologists, pharmaceuticals, and even cosmetics in some instances can be considered a part of research studies because of the mechanisms they use to advocate for or produce resources for the public. You could also consider organizations like the CDC and the FDA, example of government research studies. But there are also private research studies that are done by MPH or the American Public Health or American Psychiatric Association that produce their own studies and their own research that betters the public and public health goods. Another aspect or the third category of public health is environmental health. This is the relationship between the public and the environment. Anything that promotes human health and creates fosters a healthy environment and safe communities. This can be done by works through environmental specialists, climate activists, or government organizations like the EPA, the Environmental Protection Agency, or the Federal Emergency Management Agency, FEMA, which basically comes in and provide emergency assistance that relates to environmental crisis. There are other organizations, like nonprofit organizations, like Centers for Environmental Health, that also work towards making sure that the environment is healthy and sustaining for humans and other animals. Now, this is my favorite category of public health, the policy or advocacy side. What I mean by policy advocacy, it means the government organizations or the community-based organizations that work on public health issues through either the government or independently. A lot of these categories come out of policy because they are groundwork efforts to create organizations to address these issues, whether it's through taxpayer-funded money or donated money through grants and donations. Everybody wants to try to address these issues in their own way. And so they create these groups to advocate for these people. And the sector of public health, so far, I like to categorize as the fourth sector. Well, fourth sector to me means any non-government organization. That's going to be your for-profit businesses or your nonprofits that work to provide public health or a service in general. You might not think that it's a health-based or public health entity, but it works and behind the scenes to create a better society overall and might and affect marginalized communities that you might not even know or be aware of. Organizations that fall under this category can be considered food banks, homeless shelters, religious organizations. Anybody that works towards the betterment of the public without the control of the government. This allows them to do a lot more and in specific and unique ways to marginalized communities that you may never even heard of. Now to the why you all came here. Why should you get an MPH degree? Well, here's a trade secret that the universities don't want you to know. MPH degree can boost your resume to get you onto the next field of public health, whether it's going to the clinical side, research studies, environmental health, that fourth sector, or public advocacy. You could use an MPH degree to advocate yourself into organizations, education, or government works. There are plenty of opportunities that you can use and gain from once you have an MPH degree. And it can be used to better boost your resume if you weren't so well in your undergrad years, because not only it shows you a dedication for higher education, but it shows you that you have a knowledge of a holistic understanding of public health issues so that you can work your organizations and work for health equity issues. Now, if you like that video, please like and do the follow things. Until next time, I'll be with the people. Will you?